Many women call us, come to us in OPD for preponing or postponing the menses. They want to either prepone the menses for their exams, for their travel, for their vacation, for their honeymoon, for some kind of puja, or because of some social customs. Preponing or postponing menses is one of the most common issues with which females come to us. But the problem is, many times the female come to us a day before the desired event, whether they want to prepone or they want to postpone the menses. That is when the problem lies. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. In today's videos, we will talk about how to prepone your menses safely, how to postpone menses safely, whether preponing menses is safe or whether postponing menses is safe. Does preponing or postponing menses lead to infertility? Or can the diet or the lifestyle changes induce the preponing or postponing of the menses? We will discuss everything in today's video. But before we come to the preponing or postponing of the menses, first of all, let us understand the physiology of menses, which is very important because that is the scientific basis of preponing or postponing the menstruation. So, normal ovulatory cycle is about 28 to 30 days. The egg starts forming by about 8th to 10th day, and between 10th to 14th day the ovulation occurs. Before the ovulation, the endometrium is about 10 to 12 millimeter, and after ovulation that endometrium slightly decreases by 1 to 2 millimeter. Before ovulation, there is a rise in the estrogen, which is called as a proliferative phase, and when the estrogen reaches its peak, the ovulation occurs. After that, the estrogen declines, the progesterone increases, and that is called as a secretory phase. And after ovulation, within 14 days, the menses occurs. So everything depends upon when is the expected date of menses and when is the desired event. So suppose a female has an expected date of menses. Say I am making this video today on 8th of February and the desired menses is on the expected date of menses is on 24th of February. So I want that females should come to me at least 10 to 12 days before their expected date of menses and 10 to 12 days before their expected date of the event, whether it is a puja or whether there is a travel or whatever. Now comes two important things, whether I want to do a preponing or whether I want to do postponing. Now, first and foremost things, if the female is married, before deciding whether to prepone the menses or whether to postpone the menses or to give a withdrawal bleeding, we need to see the endometrium. Most of the females directly take a tablet called as a Primolute N or a Maprate for the withdrawal of menses, and in many times the menses comes, but many times the menses does not come also, because a Primolute N or a Maprate is a kind of a progesterone which acts on an estrogen primed endometrium, and by estrogen primed endometrium I means that endometrial thickness has to be minimum 7 to 8 millimeter for a Maprate or a Primolute N to act. And that is why if a female is married, before deciding whether to prepone the menses or postpone the menses, I would need to see her endometrium by doing a transvaginal sonography. So in this case, if the patient is coming to me on 8th of February and patient does not want the menses on her expected menstrual date is on 24th of February, but she wants to delay it till 27th of February. So what I'll do, my approach would be to delay the menses. And to delay the menses, I would see first of all the endometrium, how much it is. If endometrium is say about 10 millimeter, 11 millimeter, then I would simply give a progesterone or a testosterone tablet in form of the brand names which are very famous in the market. Is a disclaimer being, I do not promote any medicine, but because Primolute N or Maprate or Deviri are the most common names going around in the market, people take it directly OTC. So I would normally give one tablet of Primolute N till the day she wants to delay the menses. So in this case, I will start 5 milligram or 10 milligram Maprate or Primolute N till about 27th of February she wants to delay the menses. But sometimes they want an early menses. They want that menses should come early and it should be over by the time their event is there, some puja or some ritual. In that case, what I would do is I would give her a withdrawal. Withdrawal means I will prepone the menses. Now for the two things are important. For preponing the menses, I need at least 15 days. Because normally what do we do in preponing the menses? We increase the level of hormones and then we stop. That means we withdraw the hormones, and once the hormones are withdrawn, after withdrawing the hormone, within 5 to 7 days the menses occurs and that bleeding would happen for 2 to 3 days. So I would be needing a gap of at least 10 to 12 days for preponement of menses. So which hormones I give for the withdrawal of menses is very, very important. Suppose the endometrium, like I said, if it's 10 millimeter, then it is already an estrogen prime endometrium, and for that case, I would be simply needing to give a progesterone in form of a Daviri, Meprate, or a Primolute N. I normally give one tablet 3 times a day for 2 to maximum 3 days, and then I tell the patient to stop. Once the tablet is stopped, within 5 to 7 days, the menses will appear in almost every case. Now, if the endometrium instead of 10 millimeter or 11 meter, it is only say 3 millimeter or 4 millimeter. Then if I want to induce a withdrawal bleeding, or if I want to prepone menses, in that case, simply by giving the progesterone, it will not have any effect. So in that case, there are two approaches which normally we take. Either we give, first approach is we give an estrogen for 3 days, thrice daily, either in form of a ethinyl estradiol 1 tablet TDS for 2 to 3 days to make the endometrium, and followed by progesterone 1 tablet 3 times a day for 3 days in form of a Primolute N or Daviri or Meprate, whatever. And then if we stop the tablet, the period comes after 5 to 7 days. But this approach would take about 15 days. If the female has time, that much time, then it is fine. But normally, instead of giving estrogen followed by progesterone and then withdrawal, what I give is a combined estrogen and progesterone. Either that combined estrogen progesterone is in form of a ethinyl estradiol tablet with Primolute N to be taken 3 times a day for 2 days or 3 days, so that I compress that time from 6 days to about 2 days to 3 days, and then I can save about 3 to 4 days. Or instead of taking 2 tablets of estrogen and progesterone separately, I simply give an estrogen and a progesterone combination in form of a low dose oral contraceptive pill, 1 tablet to be taken 3 times a day for 2 days or maximum 3 days, again depending upon which phase of cycle the patient is. Now, if patient comes to me about a month earlier, suppose patient has got a regular cycle of 28 days, patient comes to me on 2nd of February, patient says, "Ke I want that my period should get over by 5th of February. What I can do is I can simply put her on, so for her marriage functions and rituals, I simply can put her on oral contraceptive pills, low dose oral contraceptive pills like Overall or Femilon, something like that. It has to be taken daily. The beauty with oral contraceptive pills is the moment you stop an oral contraceptive pill, you get period after stopping of 4 to 5 days. And suppose the period will happen for about 3 to 4 days, so I need that much time. So if I want that period should stop on 5th of March, so that means the period should ideally start by about 28th or 27th of February, so I will plan accordingly. So if patient wants before that, then it is not necessary to complete a 21-day strip of a oral contraceptive pill tablet. She can take tablets for 15 days and then we can induce withdrawal bleeding. This is what we normally do for planning of our IVF or IUI cycles. So the important message is, I should be knowing, people should come 15 to 20 days in advance, preferably a 1 month in advance, because usually no puja, no travel, no exams are scheduled overnight. Usually everybody knows at least 5 to 7 months or 15 to 20 days in advance that this traveling or this puja is going to occur. So everything should be planned and people should come to me earlier. Normally what happens is people come to me 3 days in advance, "Sir, we have got a puja after 3 days, please give us some tablet so that we get menses tomorrow, or please postpone the tablet. Please postpone the menses." Now, like I said, if you understand the menstrual cycle well, after the ovulation, 7 days after the ovulation, the estrogen and progesterone hormones, they come to their nadir. They are very, very less and there is a physiological withdrawal. And after the 7 days when the estrogen and progesterone, they reach their nadir, after 4 to 5 days, the bleeding process stops. So first of all, I have to know at which part of cycle you are coming to me. If you are coming to me post ovulation after 7 days, then whatever I do, it may not work 100%. For my tablets, either to prepone or to postpone to work 100%, you have to come to me at least 7 to 10 days in advance. Even if you come to me at around the ovulation time, that I'll be able to give you a 100% guarantee that yes, your period will come early or your period will be postponed. Now, if people are in a dilemma whether to postpone the period or to prepone the period, then the best thing I always advise, if you want to be 100% sure, it is always better to postpone the period rather than prepone the period. Because in postponing the period, I continue the tablet till the day I want to postpone, and I have to take only 1 tablet a day if you have come to me at least 15 to 20 days in advance. But for preponing the tablet, I have to give you 3 to 4 tablets a day for about 2 to 3 days, and then I stop the tablets. But I do not know at what point your body's endogenous hormones are, how the exogenous hormones will act, and after their withdrawal, how long you will take to get periods. So there will always be a period of uncertainty and you will never be 100% sure and it will always be a matter of touch and go. So if there is a very important ritual in puja or marriage where you do not want the periods, then in that case I would advise that it is better to postpone the period. Now for postponement of period, again, like I said, if there is a marriage, you know that marriage is happening after 1 month, I would advise to be on a oral contraceptive pill. Oral contraceptive pill, low dose oral contraceptive pills nowadays are extremely safe, extremely effective, without almost any side effects, and they can be taken till the time you don't desire the periods. Now, are there any side effects of postponing the periods? See, if you look at the menstrual cycle, the secretory phase, that means after ovulation, before the periods, when there is an increase in progesterone in the body, progesterone somehow leads to the tendency of a bloating sensation, a heaviness in breast, some kind of a premenstrual syndrome. So those minor changes would be there, but they would not be such that they would impact or affect your quality of life. So I would always advise, if you have got time, if you know things in advance, it is always better to postpone, and maximum you should come to me at least 20 days in advance, so we can plan whether 20 days before your expected date of menses or whether 20 days before the event in which you are supposed to come. Now suppose you are expecting that you have your periods in couple of days, suppose 3 days from now, or there is a period tomorrow and you want that period should stop. Then in those emergency cases, we give NSAID. Best NSAID is Combiflam thrice daily for 1 or 2 days for that emergency event. We can also give tranexamic acid and ethamsulate. This tranexamic acid, ethamsulate and Combiflam would almost decrease your period by 90%. But starting any hormone will take at least about 3 to 4 days to take its effect. So if there is a dire emergency, then you can take these 3 tablets. Yes, it will be heavy, it may cause acidity. You can take an antacid tablet or an antacid syrup or a pantoprazole domperidone tablet along with that, but your event would be taken care of. But many people come, sir, give me an injection so that I get a period tomorrow. My period stops after 4 days and I have a function after 5 days. I want preponement of menses. That is not medically possible. Scientifically, it is not possible. And if somehow for some doctor, for some patient in past, somebody may have taken an injection and that injection may have caused her to get the periods, that may have been a coincidence. That means that the period which came was not because of the injection. Period would automatically would have come in spite of not giving the injection. So there are, in many cases, you should be very, very clear that you should not be using this preponement or postponement of periods often. Once in a while or once in a year is fine, but if you do it often, your periods would get irregular. Because of this irregular period, if you are planning to conceive, you may find it difficult to know your days of ovulation today on the days on which to plan conception. Take preponement or postponement of menses as such does not lead to infertility. It does not lead to weight gain. It does not have got any major side effects. But for 3 to 4 months, your cycles would get irregular because there is a natural circadian rhythm in your cycle. Some people say, I have taken papaya, I have taken pineapple, I have taken all these garam vastus, ginger, turmeric and all those kind of things. Still the period has not come. Some people say, I do all kind of heavy exercises, yoga, walking, running. If you are doing heavy exercises, if you are an athlete, then it is less likely that your period would come. By eating papaya, by eating pineapple, by eating hot milk, ginger, turmeric milk, again it is pure coincidence. There are no scientific logic that they would induce the periods. So in the conclusion of video, I would share 3 points. Postponement of menses is always better rather than preponement. Before a desired event or before the expected date of menses, you should visit your doctor at least 3 weeks to be 100% sure of either preponement or postponement. If you have got the minimum amount of time in which you should visit the doctor should be at least 7 to 8 days before your expected date of menses, so that we have got enough time to postpone your menses. If you come 7 days before your expected date of menses and you want preponement, that is not possible. There is no tablet, no injection which we can give today and tomorrow you will get period. I'm sorry, that does not occur. Even for preponement of menses, it is better to look at the endometrium, especially while doing a transvaginal sonography. If endometrium is thin, then simply by giving the progesterone or norethistérone, the period won't come. Endometrium has to be minimum 7 to 8 millimeter of thickness. It has to be estrogen primed for period to happen. Sometimes, so the best choice of drug to postpone menses is if patient just want to take a simple tablet, and also it is a cost effective, we give a simple low dose contraceptive pill. The contraceptive pills which were available earlier in the market, Mala D, Mala N, those were high dose contraceptive pills. They had got increase in the estrogen content. We nowadays give very minimal amount of estrogen content in market, so that the side effects of estrogen, side effects of progesterone are not there along with that. I hope, I believe, and I pray that this solves many of the queries of females. It carries a good carry home message. Please like the video, please share the video, please subscribe to our channel. Namaskar, bye bye.